My name is Robert Zeiser. I'm a full professor and the director of the section of tumor immunology at Freiburg University Medical Center in Freiburg, Germany.
My name is Michel Sadelain. I work at Memorial Sloan Kettering Cancer Center in New York.
Dr. Zeiser is the coordinating editor for the Blood Review series on strategies to improve Graft-Versus-Leukemia effects, and Dr. Sadelain is among the authors contributing to the series.
I was enthusiastic to approach the authors of this review series because I believe that there were major advances in the field of relapse treatment in the last 5 to 10 years achieved. And so it made me happy that we were allowed to put together a review series that will comprise the standard treatments, but also novel emerging therapies for relapse treatment. There are 4 major treatments that we will highlight. This is, first of all, the work of Jeff Miller was chosen because NK cells play an important role after allogeneic stem cell transplantation, and the group of Dr. Miller has developed novel approaches to prolong the survival of those NK cells. Then we have the topic of tyrosine kinase inhibition for patients with FLT3-ITD mutant AML, and the treatment of relapse with immune checkpoint inhibitors, in particular CTLA-4 antibodies, presented by Dr. Robert Seufer. The third review series is presented by Dr. Hans Gretinger from Tübingen, who has a review on gamma delta T cells as a rare T cell population that has potent anti-leukemic activity and is promising to treat patients with relapse without having graft-versus-host disease. And the fourth part of the review series is on CAR T cell technology, which is presented by Dr. Sadelain from New York. And these are engineered T cells that have a chimeric T cell receptor that recognizes antigens on leukemia cells and then leads to the elimination of those leukemia cells.
Graft-versus-Leukemia effect is a long-standing topic of interest in hematology for the last 30 years or more. And it goes back to the demonstration that a bone marrow transplant is not just about providing hematopoietic stem cells, but also an immunotherapy, and that the T cells that are present in the graft mediate a very critical aspect of this therapy, and that's tumor rejection. Over the years, it became clear that it was primarily mediated by T lymphocytes present in the graft. It also became very clear that T cells can have this good effect, but can also have a very negative effect, known, of course, as graft-versus-host disease. And for many years, investigators have tried to tease apart those good T cells from the bad T cells. In the era of what we now call chimeric antigen receptor therapy, or CAR therapy, we now see a path to design T cells that will have the graft-versus-leukemia effect without incurring the risk of graft-versus-host disease. And that's made possible through T cell engineering. Most of our experience, collective experience, is based on the use of CARs that target this molecule called CD19. And several centers today have trials targeting CD19 in either leukemias or lymphomas, most of which arise from the B cell lineage and therefore express this molecule, CD19. In 2017, the FDA approved the first 2 CAR therapies, and we anticipate more approvals to follow in 2018.
This has revolutionized the therapy of this disease, and in particular for chemotherapy refractory lymphomas and leukemias, this therapy has really changed the field and has improved the outcome of patients.
What we have done is demonstrated that engineered T cells can make good medicines, and in doing so, convinced some scientists or physicians who didn't believe that that would be the case. We also convinced big pharma to now develop cell therapy programs. This big wave now means that there will be more CAR therapies. There will be more engineered cell therapies. It has caught the imagination of a number of our young trainees.
I think this review series on the treatment of relapse after allogeneic hematopoietic stem cell transplantation is very important for hematologists because it helps the treating physician to look up what are standard procedures to be done in patients that relapse with hematological malignancies, but also to get information about novel emerging therapies that will come probably in the next 5 to 10 years. I believe we are on a good path to better understand and better use the immune response against tumor cells. And so I think it will be an exciting period of time.
There are enormous possibilities in medicine that open up based on the use of genetically engineered cells for B-cell malignancies today, for myeloma perhaps very soon, and beyond oncology. Engineered T cells will hopefully find their place in severe infectious diseases and in autoimmune disorders. And so there's a lot more to come.
Please find this review series and other blood content on bloodjournal.org. This presentation is copyrighted by the American Society of Hematology.